Let's start with this September 2023 question number 1. 70-year man retired for the farm worker with a scaly lesion on the back of the wrist. Biopsy shows enlarged pleomorphic squamous cell mitosis do not pass beyond the basement membrane. This is dysplasia, limited to basement membrane dysplasia. Trauma to the face affecting orbital and suborbital feature, conjunctival hemorrhage, epistaxis. What is the nature of site? So this is orbital, periorbital, conjunctival hemorrhage, epistaxis. So it can be in between the nasal and ethmoidal bone, because what is there? Subconjunctival hemorrhage, periorbital, it is a raccoonize, and epistaxis lead to the specific symptoms due to proximity to the orbit. The combination of periorbital hemorrhage, bruising around the eye, raccoonize, and conjunctival hemorrhage, blood in the white part of the eye, and epistaxis, nosebleed is classical presentation of nasoethmoidal. Nasal fracture involves central part of the midface, including nasal part. Nasal location accounts for maxillofacial orbits. It can be such as broad fracture, primarily affect orbital floor, exophthalmos synchronize. A 55-year-old builder diagnosed with 10 years ago with asbestosis. Asbestosis means shortness of breath. Mesothelioma is very common. 45-year-old lady presented with 3 centimeter mass in the left breast, appearing irregular in shape. What is the next investigation? Now, on sonography is irregular. This is 3 centimeter mass. You have to go for core biopsy. Indication for MRI, no, we will not discuss that. 30-year-old patient brought to the emergency with a history of anosmia and CSF fluid like which bone? Anosmia is either cribriform plate or ethmoidal bone. Ethmoidal or cribriform. Now, yes, cribriform, nasal. 45-year-old presents with a cough and weight loss. 3 months. She has also complained of recent onset of polyuria. Her pulse is BP is X-ray shows irregular mass lesion in the right upper lobe. Her serum calcium is this 3.5 would be most informative. Now, parathyroid hormone related peptide, hyperparathyroidism. 70-year man present with difficulty in swallowing in the solids and liquids. Bird beak appearance of the lower esophagus. What is most likely be? Bird beaks is supposed to be the achalasia, but patient is having both solid and liquids. Esophageal, okay, it's achalasia only. Rat tail. Achalasia corrected by failure of lower esophageal manometry. Next question. A tall, thin 21 present with a complaint of swelling in the front of the neck. Last 4 months on the exam, she has swelling in the left lobe of the thyroid and multiple neuromas in the oral cavity. Her blood pressure is very high. Pheochromocytoma. MEN2. Medullary thyroid carcinoma cells produce calcitonin. MEN2. 50-year man with the history of a chronic alcoholic and presents with the hematemesis. Alcoholic hematemesis malarious. Okay, just a minute. Chronic alcoholic hematemesis, hypotension, distended veins over the abdomen. This is caput medusa because of esophageal varices. Cirrhosis causes portal hypertension. Leads to liver portal hypertension, causes esophageal varices, common significant upper GI bleeding. 45 presents with the winged scapula after stab into the lateral thoracic wall. Winging of scapula is this serratus anterior. Injury to the long thoracic nerve. 25-year man presents with thyroid nodule. Is serum calcium, thyroid nodule and diarrhea. Calcium is elevated. Genetic testing rate which type of thyroid cancer? Rate means medullary. Calcitonin is increased. 25-year man present with difficulty in flexing the arm and loss of sensation in lateral osseous. Which nerve is most likely to be injured? Musculocutaneous. Musculocutaneous inner biceps, break and flex forearm. A young man presents with the pain and swelling in anatomical scaphoid. 50-year-old man presents with epigastric pain, radius to the back, nausea, vomiting, serum amylase, lipase are markedly elevated. Elevated. She supports reports history of gallstone. What is mostly diagnosis? Pan back pain means pancreatitis. A man suffered a posterior dislocation of the hip joint in the car accident. Which nerve is most likely to be sciatic? Study comprised two techniques for the appendectomy. 95% confidence interval for difference in operative times between the two techniques is minus 3.2 1.5 times. So it is around what is correct interpretation of confidence interval. So by chance the mistakes can be of around this range 1.5 above 1.3. Standard technique significantly there is no statistical difference. The study proves that two techniques standard deviation of data no technique is significantly faster. 95% confidence interval, difference in operative times between the two techniques is minus 3 to 1.5 minutes. So if it is 1 hour, it can go minus 3 minutes down or it can go above 1 minute down. So among 60 it can be, so two standard deviations is, it is significant. No statistical significance between the operative time between the two techniques. Okay. The range indicates that the new technique might be faster up by 3.2 times or standard technique might be faster by 1.5 times. But because 0 is included, we cannot conclude that one is definitely superior to other based on the study. Only fails to reject the, okay, it is not significant. There is not much difference. 70-year-old woman present with knee pain and difficulty in extending her leg after femoral nerve injury. Which muscle is vastus rectus femoris? Quadriceps, back, quads. Why not A? What was A? Sartorius. Hip and knee flexion. Both sartorius causes flexion at hip and knee. 45-year-old male presents with severe colicky right pain radiating to the groin. Colicky right flank pain. Urine reveals microscopic hematuria. What is likely diagnosis? Renal colic. 30-year-old present with a wrist drop after prolonged use of crutches. Which nerve? Axillary. Why not axillary? Crutches is not radial. Okay. Radial nerve, posterior. It is radial nerve at the level of axilla. Radial humerus compress the crutches. Okay. The newborn is delivered with the arm abducted, adducted, medially rotated, and forearm extended. Which part of the brachial plexus? This is Erb's palsy, upper C56. Erb's palsy. Patient presents with a pain and temperature sensation on the left side of the face and the right side of the body. Which of the brainstem is likely to be affected? The patient presents with loss of pain and temperature sensation on left side of the body, pain and temperature on the left side of the face and right side of the body. Thalamus or medullary decussation of vein fibers. Occlusion of the posterior presentation is on lateral medullary environment, which results from occlusion of the posterior inferior pica. It causes ipsilateral face and contralateral body sensory deficits. Pica, posterior inferior cerebellar artery. 55-year-old presents with a slowly enlarging nodule and biopsy shows tumor cells invading thyroid blood vessels, follicular thyroid is characterized. 35-year presents with a frank hematuria, ultrasonic interference, multiple renal cysts. His father is similarly in which likely diagnosed polycystic kidney, autosomal dominant polycystic kidney disease, autosomal recessive A. 60-year-old man present with severe chest pain and radiates to the jaw, shows ST segment elevation, lead to 3 AVF. Which coronary artery? Lead through 3 AVF, left anterior descending, right coronary. Chest leads, if it is involved, then it is left coronary, inferior wall infarction. AVL, lateral circumflex, AVF, right coronary. Mm, 30-year-old man present with a heart painless man in the right breast. Mammography shows speculated mass. What is the most next step? Heart painless, core biopsy. Speculated mass and mammography. 25-year man is brought to the emergency department with a road traffic accident. He is hypotensive and distended neck pains and decreased breath sound on the right side. Which is the most appropriate immediate management is needle decompression. So let's continue for the last today's, where is that section? Rapid revision, no, where is it? Is MRCS 26. So we have to go for 33, question number 33. 50 questions. Let us see in continuity whether I can do it. This is today's. I have to go for 33. So these are the questions done by in the group. I'm just reading the questions and then solving is, yes, 33 onwards. A patient presents with a foot drop and loss of sensation of the dorsum of the foot and hit on the lateral side of the knee, and which nerve is injured? So this is dorsum drop. A 33-year patient, foot drop and loss of sensation over the dorsum of the foot after being hit on the lateral side of the knee. Which nerve? So there is foot drop means deep peroneal. Foot drop. Common peroneal means loss of sensation with foot drop. That's why common peroneal. 30-year man present with painless thyroid fine needle aspiration reveals large nuclear grooves means papillary. Patient present with loss of pronation, weakness in wrist flexion. He also has numbness over thenar means right side thumb. Wrist thumb is there. Thenar means median nerve. It has to be median nerve. Newborn presents with the swelling in the lumbar region, imaging the vertebral arch, defects in the vertebral Imaging confirms a defect in the vertebral arch with herniation of meninges, spinal cord, and everything meningomyelococele. Patient is unable to elevate his right shoulder and has difficulty in abducting. Elevate the right shoulder, abducting beyond 90 degree after neck dissection surgery. Access spinal accessory nerve. A young man was involved in motorcycle accident and sustained midshaft humerus fracture. On examination, wrist drop and weakened grip. Which nerve? Radial nerve. 50-year-old man presents with the bulge in the groin and becomes more prominent when he coughs. On examination. A soft reducible mass is noted and patient has no pain. What is the man is there? Bulge becomes prominent, cuffs reducible, noted, patient has no pain. Now inguinal hernia, bulge in the groin which becomes more prominent when he coughs. On examination is soft reducible, noted, and patient has no pain. It has to be inguinal hernia. Most common type of hernia in men, that's why it is chosen. 23-year-old patient presents to emergency department with head trauma, multiple episodes of depressed fracture. He was normal and conscious. What is your management? Depressed fracture, you CT in 1 hour. "35-year building worker hit in the head by tune of scaffolding. He was noted wearing a helmet. He was not. He was taken to the hospital by the foreman and skull suggested depressed skull fracture. Which of the following appropriate management? Allow him no CT scan immediate. So this is nice guidelines. Head scan criteria more than within 1 hour. When you do, if the Glasgow coma scale less than 12 on arrival and comes down after 15 to some after 2 hours, suspected open depressed fracture and signs of basal skull fracture, recognize battle sign, all this. Within 8 hours, amnesia, loss of history, if amnesia is there, coagulopathy, dangerous mechanism. CT scan for the children is within 1 hour, suspected non-accidental injury, post-traumatic seizures, convulsions, and depressed skull fracture or same within 1 hour, abnormal anticoagulants, person who are taking DOACs or antiplatelet agents, aspirin, even without signs. A patient needs scan within 8 hours. Tranexamic acid use less than 12, give IV bolus within 2 hours. Cervical spine imaging, whenever CT scan, CT cervical scan, if GCS intubated polytrauma, neurological deficit, paresthesia. Admission criteria, imaging shows clinically important abnormality, GCS less than. Discharge criteria, GCS 15 and above, normal imaging, no signs of clinical. This a 50-year-old man. 50-year-old man arrives the EAD with his consciousness. He can localize the pain. He can localize pain, opens the eyes. He can localization of the pain is 4. Extension is 2. Flexion is 3. Withdrawal is 4. Localized pain is 5. Open eye to pain is 2. And inappropriate words 5, 2, and again 3. I think 5, 2, 3. It has to be 10. "55-year-old female presents with 2 centimeter nodule and no symptoms, FNAC benign. What is the best management of the case?" FNAC benign, 55, 2 centimeter nodule, no symptoms, hemithyroidectomy. FNAC was benign. What is 2 cm, 55 or 2 centimeter thyroid nodule, no symptoms, FNAC was benign. Discharge and follow-up, review ultrasound. You have to do It's 2 centimeter nodule. Okay, you are not done. Still, you are not done anything. It is clinically 2 centimeter nodule. If you do sonography, FNAC, and everything, then you have to go for regular ultrasound monitoring recommended for thyroid nodule, whether it is change, it is benign or it is cystic or solid. 6-week pregnant woman presented with palpitation, heat intolerance, and swelling in the neck. What is the best? Swelling in the neck is propylthiouracil. 25-year thin woman present to the surgical clinic with 4-month history of neck swelling. She is experiencing episode of flushing, blood pressure, vinyl, serum catechol, urinary vinyl mandelic acid is pheochromocytoma suspicion. Serum catecholamines and all that. 35-year female patients with woody neck is riddles. Rare form of thyroiditis. 62-year-old woman present with a firm irregular mass in the upper quadrant of the right breast. This is malignant or mammography. Finding cytology, mammography and FNAC. She is treated with wide excision axial clearance. Which of the following histopathic finding would imply better prognosis? Presence of ER receptors, if it is there, it is better. Which of the feature of mammogram is least likely to be suggestive of carcinoma? Popcorn. 28-year-old lactating pregnant with fever, diffuse erythema. This is diffuse erythema, no palpable, no pulmonary lactational mastitis. Symptoms of fever, inflammatory. 23-year female presented with intermittent discharge 6 months ago. She has nipple piercing, and what is the possibility diagnosis? Fistula of memory. A benign tumor, no. 33 female presented with the intermittent discharge 6 months ago. She has a nipple piercing, same as memory fistula. No lump on examination. What is possible diagnosis? 33 intermittent discharge. 6 months she has nipple piercing. What is the organism in the discitis? Staph aureus. Child known to sickle cell and salmonella. 35 female painful diffuse swelling inflammation in her breast with organism causes this condition. 35-year female develop painful diffuse inflammation in the breast. So 35 painful staph again. Man develops severe gangrene and color changes affecting perineum and extensive necrotic tissue. The gangrene, which bacterial growth? Polymicrobial. 35-year-old patient with chemotherapy for lymphoma underwent an emergency appendectomy. Lymphoma chemotherapy. 5 days later, wound appears gangrenous, foul smelling discharge. Broad spectrum antibiotic. Remove the suturance. Ultrasound intraoperative debridement. 5 days later, wound appears gangrenous and foul smelling discharge. Intraoperative debridement. Vancomycin is considered which type of antibiotic? Glycopeptide. 43-year-old diabetic man present with a gangrene lower thigh. Examination revealed crepitation, fluctuation, foul smelling discharge, piperazine, tazobactam. 43 present at the clinic with a history of persistent watery sigmoidal performed whitish creamy layer. What is most likely causing a Clostridium difficile? 23-year-old man presents with the 3 months following extraction of the caries tooth and plaque-like infiltration of the upper jaw and sinus forming sulfur granules. Discharge actinomyces. 65 diabetic patient presented to the vascular unit with infected distal 2/3 of the left foot. Weight gangrene cellulitis. What is most likely causative organism of diabetic foot? Polymicrobial again. A 54-year female with a history of recurrent UTI is presented to the clinic with the left loin pain. Investigation reveals stagon calculus. What is most likely Proteus? Metabolic screening of the 32-year male with recurrent renal stones was undertaken. Which of the following most probable diagnosis? Hyperuricemia, idiopathic cystinuria, or gout? Cystinuria. 49 female had nephrostomy, infected hydronephrosis. She is now undergoing hysterectomy. What is the antinicotide? Some questions are given. Antigrade, CT scan is here, nephrostomy is here. Now what is this? Had nephrostomy for infected hydronephrosis 3 months ago. She is now undergoing hysterectomy. What is best invest to know cause of hydronephrosis? Cause of hydronephrosis. So antigrade will give the obstruction. CT imaging best option to evaluate anatomy and cause of hydronephrosis, especially with the history of fibroids and previous surgery. History of painless hematuria, clots causing acute renunciation. What is best initial? Old smoker, cystoscopy. 16-year-old female in clinic 23, cholecystectomy. Her operative sheet denotes minor blood loss, gallbladder shrunken over small stone was extracted in plastic bag, no spillage. What type of clean contaminated? Slide 8. 9-year-old presented image riding bicycle, sudden pain, testicular pain, immediate exploration. Tunica vaginalis attaches posterior to the testis, fixing to the scrotal sac, limiting the movement, ball clapper deformity, allowing testis. 54-year-old man present with a left-sided persistent scrotal pain. Examination revealed left-sided varicocele supine. What is the next investigation? Now their CT scan is there. Now they will say testicular ultrasound. Now renal ultrasound. CT abdomen, renal ultrasound. D. Renal ultrasound. CT scan of the abdomen. Varicocele that does not reduce in size while laying down indicate retroperitoneal mass. The renal vein warrant abdominal imaging. Now onset of varicocele or not subsiding with supine position more than 40 orders CT scan. Lying supine, obstructing mass, retroperitoneum. Patient present with left varicocele vein. What is the initial investigation? So this is different. CT abdomen ultrasound. Here you are done ultrasound. Patient present with left-sided persistent scrotal pain. Examination revealed left-sided varicocele. Supine position does not reveal symptom. What is the next? Here you do CT scan. Dragging sensation in left scrotum. Doctor evaluates soft mass which is bag of arms only when patient is standing, doesn't disappear lying down. Initial investigation is sonography. Only when standing, doesn't disappear lying swap. Initial investigation. Complaint of high flow urinary retention, DRE, firm enlarged prostate, PSA. What type of pathology? Hyperplasia. 32-year man ran into the tree, right back, blood at the meatus. What is the next step? Ascending urethrogram. What is the most accurate? Spreads via pre-vertebral arterial plexus, usually metastasis to liver. Tumor is highly vascular, also with reactive sclerosis in vertebral bone. C. 2-year-old child with notice to has dorsal slit in the penis and anomalies associated with each of the following: bladder exostrophy. 3-year-old lady patient present to the orthopedic clinic with history of progressive back pain. On examination, focal sclerotic changes affecting the spine means increased PSA has to be there. 43-year-old male athlete suffered a mid-shaft radial fracture while taking marathon. On examination, there is no neurovascular injury related. Which of the following options can induce primary healing? Mid-shaft. Induce compression plate casting, intermittent layering. In compression plate. Primary bone healing, which is direct healing without calculus, occurs best with the rigid fixation. 7-year boy had a cold a week ago. Now he is symptom well. In prexic, his hip movements are limited. Transient synovitis. Twelve-year boy presented with after trauma to his wrist. X-ray normal. He was discharged. He is now presenting back with the wig. Anatomical snub box is scaphoid. 12-year child present with obvious limping and present internal rotation. He denies any history of trauma. He is now most accurate diagnosis. 12-year obvious limping and limited internal rotation, denies any history of trauma. Perthes age has gone up now. Slip and disc. 30-year patient subcapital close reduction, excellent prognosis. 1 year with the pain and stiffness. What is the most? So 30-year patient, subcapital femoral neck, non-union or avascular necrosis. 6th month malunion. Avascular common complication femoral neck when managed. 1 year avascular necrosis, less than 6 month malunion, more than 6 month non-union, 5 years secondary. Now 32-year-old is brought to the emergency department after a fall. Investigation revealed distal radial fracture. Which of the following is underwent casting? 2 weeks later, present back pain and inability to extend the thumb. Extends the pollicis tendon rupture. 50-year present to the double antiplatelet therapy for mitral replacement. She was now going upstairs. She felt knee her give way. Examination of a large swelling. Cannot straighten her neck. Spontaneous hemarthrosis. Or what is quadriceps muscle rupture? 82 suffered a limb trauma during the fall. He is unable to initiate the abduction of the arm. Which is following most likely? Initiate the supraspinatus muscle supplying to suprascapular nerve. 23 athlete was brought to the emergency room following twisting injury, minimal swelling and detected and general medical treatment following before the patient came back. 1 month later on examination, pain on the medial side when he was vested quadriceps muscles with intact knee extension except for last 5 degrees. Which of the following is most likely? Medial meniscus is definitely because of medial side. Estrogen receptors, okay.